Sexual health is one conversation or one topic that many people shy away from. But it is one important conversation that you and I we need to have. From the silent infections to the ones that show clear signs. On today's episode of Health Unplugged, we'll be talking about everything: how to protect yourself, your loved ones, things that put you at risk, and how to prevent yourself from getting STIs and STDs. My name is Amazing Rita, and with me in the studio is Dr. Dimba Favor. Hi, Dr. Favor.
Hello, Rita.
How you doing?
I'm fine. How are you?
You wanted to be dramatic, but you're just pressing it. So we'll not tell them what happened behind the scenes.
No problem. Let's keep it behind the scene.
Okay, so today we're talking about STIs and STDs. Let's learn about it. Let's learn about the things that can affect our sexual health. Because when it comes, sexual health does not just concern you; it concerns your partner. Even if you don't have a partner, it concerns your loved ones, the people you stay at home with, the people you interact with every day, the people that can just pick up your toothbrush and brush with. The people that can just take one razor blade that they see in your house and use it.
So I think it includes the society at large.
It includes the society at large. All right, Dr. Favor, what is STI, STDs? Like, what's the difference between them?
STI, sexually transmitted infection.
Yes.
STD, sexually transmitted disease. Infection is like, this is what the person gets from any form of sexual intercourse. While STD is the outcome of the STI.
Oh, the senior brother. Yeah, he
I
graduates.
don't know if it makes any sense.
Yes.
STD, the sexually transmitted disease, is the outcome of sexually transmitted infection.
Okay.
Yes, like the infection is what is gotten, but then what, like these symptoms you're seeing, the disease
I get it.
is now
STI. We grow, get bigger, and turn STDs. Tell us, what are some of the common STIs that we have?
Okay, we have syphilis, gonorrhea, even the common hepatitis B is a form of STI. HIV and AIDS is a form of STI. Anything at all that can be gotten from sexual intercourse, whether anal, oral, any form of sexual intercourse, you consider it an STI.
As well. So let's talk about the difference between bacteria, between viral, and between parasitic STIs.
Okay. The difference is that the organism, the causative agent, just like you listed, parasitic is caused majorly by parasites.
Okay.
Viral is majorly by viruses.
Okay.
Bacterial is majorly by bacteria. Then the modes of treatment won't be the same.
Oh, okay.
Yes, antivirals will work for those ones caused by viruses.
Virus, okay.
Antibacterial will work for those ones caused by
bacteria.
Exactly. So the modes of treatment or management, they are different.
So, Dr. Favor, can someone have or like is infected with STIs without showing any symptom?
It's very possible.
Okay.
There's something called incubation period.
Yes.
This is the time from exposure to when the person comes down with symptoms.
Okay.
So someone could get infected, could contract the infection, but would not show symptoms until the incubation period.
Okay.
It's also possible for some STIs, like now, somebody has contracted the hepatitis B virus. The person will still be normal in the meantime until the incubation period.
Okay. Are all STIs curable?
Most are curable, but not all.
Okay.
Yes. There are some that are not curable. Just like now, someone contracting HIV and AIDS, when it gets to AIDS, it can't be cured. Remember I said any infection gotten from sexual intercourse, irrespective of the route, is considered an STI.
An infection, yes.
So somebody, like some example, someone has contracted HIV. When it gets to AIDS, it can't be cured.
Okay.
So some of them are curable, while some cannot be cured.
All right. So what are the symptoms someone might see or notice that would suggest an infection?
Infection. There could be high fever. There could be lower abdominal pain. There could be painful urination. Some people come down with thrush, oral thrush. Some people come down with sores on their genitals. Yes, so these are some things that can be seen. I'll tell you, this person has an STI most likely.
So let's talk about mode of transmission. Are there some infections that can be transmitted only by oral sex or only by anal sex? Or every infection can pass anywhere and enter the body?
You know, in medicine, you never can say never. You should never
Yeah.
say never, and anything is possible.
Possible.
But then, whatever means, just know that there are infections that can be transmitted through whatever means.
Okay.
Even if it's the direct, the normal intercourse, that one, HPV, human papilloma virus, that causes cervical cancer can be transmitted through that. So there are equally sexually transmitted infections that could be through oral sex, through anal sex.
Okay.
Yeah.
So tell us about, can someone contact or can someone get infected by sharing utensils or sharing, because I've actually heard, that's why I started with it, that some people can get infected by sharing as simple as a toothbrush.
Okay.
Okay, I've heard, so just help me clarify that.
I
Then
will.
some people through kissing.
All right.
Can someone get infected through kissing, sharing utensils, or sharing personal belongings?
Okay.
Like, even though it's not a sharp personal, that's why I say like toothbrush.
Yes. Okay, for kissing, yes, it's possible. Just like the hepatitis B now. Yes. The mode of transmission is through anything that involves bodily fluid, body
Okay,
fluids,
okay.
yes. So saliva, although the virus in the saliva is usually minute, but is very possible. Then for sharing things as little as a toothbrush, it's equally possible. The reason is this: someone could have an injury in the mouth or an abrasion, and then after using the toothbrush to brush, like the blood, the toothbrush gets in contact with the blood, maybe from causing an injury or just something, and then another person using it immediately or some minutes later. Some viruses or some organisms, they have lifespan outside the body. So some of them can survive for some minutes, some of them can survive for an hour, for some hours. Exactly. So depending on the duration. So something as simple as a toothbrush can equally be used to transmit infection.
Let me get this straight.
Okay.
Is it if the person has an open sore, or even if you don't have?
No. It must be from an open sore.
Okay,
Yes,
okay.
because that open sore now will expose the toothbrush to blood that contains the virus.
Okay,
Do you understand? And then that virus on that toothbrush, it depends on how long it can stay outside the human body.
I mean the other person that uses it.
Yes, that's what I'm trying to explain now. It depends on how long the virus can stay outside the human body. So imagine a virus now that can stay for some minutes or an hour, and then this second person is coming, taking that toothbrush that has been exposed to the blood that contains that virus in less than an hour. The virus is still alive. So when this person uses it, if the person equally has a sore, it will be transmitted directly into the bloodstream. So it's possible.
Okay. You talked about incubation period. Let's not go far from that.
Okay.
You said it's like before the moment the person is exposed, and the moment the person comes down with a symptom.
Yes.
Do they have all, like the infection? Do they have one incubation period, or they
No.
have different?
Different, they vary.
Okay.
Yes, like different organisms with their different incubation period.
Okay.
Incubation period is the duration from the time of exposure to when the person comes down with symptoms. Yes, so not all organisms have the same incubation period. It varies. Even as, okay, now using the HIV virus as an example, if you, depending on the kind of investigation you want to do, the incubation period varies. If you do a PCR, it would show you the organism in I think in the space of 48 hours. But if you're doing a normal immunoglobulin test, that one will take up to 7 days. So the incubation period varies. It's not fixed for all organisms.
By that, you're saying that if someone gets exposed to probably HIV,
Yes.
and the person goes to the hospital to do tests, that's around that period,
Okay.
the result might come out negative.
It's very possible. The reason is based on the type of investigation done at that period. If you're doing a PCR that one would give you, it would tell you if that person is positive in the space of 48 hours. But if you're using maybe immunoglobulin or blood test, that one may take longer duration.
Okay.
Yes.
So how can people prevent themselves from being exposed to STIs?
Okay. First of all, we'll say abstinence is key. But then, if you refuse to abstain,
If you refuse to abstain, yes.
if you must go ahead, you should ensure. Okay, for couples, they can't abstain. Yes, they are married legally. So be faithful to your partner.
Okay.
Yes, because this person, Mrs. A, could be faithful while her husband, Mr. A, is not faithful. Maybe he's going around sleeping with various people. He would further come to infect his wife with the virus. Exactly. In a case where both of them decide not to be faithful, this person is exposed to another person, this person is equally exposed to another person. Whatever she collects from this person, he collects from this person, they'll come and interchange. And just like there's something that occurs in HIV patients. Yes. Even if the couple are both infected with HIV and then they are not faithful to each other, the Mr. A could collect another strain of the virus and infect his wife, who is already HIV positive, with this new strain he has collected. Another thing is practicing safe sex, the use of condoms, just protective measures. Majorly, then.
How? Yeah, I can hear you.
Majorly, these are the ways to help stay safe to an extent. But then, like we said, the best method is abstinence.
How effective are condoms?
You won't really say, anyway, they are effective, but not 100% effective.
Okay.
Yes, there could be a rupture somewhere, it could tear somewhere, and then whatever you're trying to prevent will leak out. The body fluid you're trying to prevent from having contact with the person, it will leak out from the opening or the space, thereby exposing this person to the virus. So you won't say they are 100% efficient or effective.
Yeah. So if someone gets infected with a particular STI,
yes,
gets treated, is there a possibility of that person getting reinfected with that same infection again?
Yes, it's very possible, and the reasons are these. First of all, if the person was previously not treated well, yes, it could, the person could get reinfected. Secondly, even if the person was treated so well and the person got free from the infection, if the person is re-exposed, if the person does not take precaution, if the person is re-exposed to the virus, the person could be re-affected or reinfected. Yes, it's very possible.
Okay. Also, I want to know, when it comes to gender, are there STIs for men and STIs for women?
Not 100%. Okay, just like now, I said the human papilloma virus, just like now, many people know that it causes cervical cancer in women. So like, how is it affecting men? There are other strains. It's not just the 16 and 18. 16 and 18 are the strains that cause cervical cancer in women, but then there are other strains that could affect other men.
Okay.
Yes.
All right. So untreated STIs, what can it cause in the body?
Okay, untreated STIs can further cause things like infertility. Imagine a woman now who has an STI or a polytreated infection. It could cause PID. PID is pelvic inflammatory disease. And when that occurs, that's one of the risk factors for infertility. So it can cause infertility in future. Another thing it can cause is that it can further affect the general well-being of this person. Because imagine the virus now, let me use the HIV now as an instance. This person gets exposed and then is not even interested in getting treated. You know, currently now they have the heart highly active antiretroviral therapy. It's not like it cures it, but it helps reduce the viral load and then keeps the CD4 count in a good state, which is protective enough. So someone who maybe contracts the virus and refuses to get treated, you know the aftermath of HIV and AIDS, when it progresses, it gets to a point it's even affecting the kidneys, can affect other parts of the body. So these are some things that poorly treated or untreated STIs can result in.
So can pregnant women get infected?
Of course they can.
Then what's the effect of of an infected pregnant woman on the pregnancy and on the unborn child?
Okay, for the unborn child, it could cause growth retardations.
Okay.
Yes, this baby will know, this fetus, that's what is inside, will no longer grow very well. Sometimes they could get born with some issues.
Okay.
Exactly. Like some of them could have ophthalmia, neonatorium, different things. Then for the mother herself, it could even lead to an abortion.
Oh, okay.
Remember, I know we once had a session where we discussed, I can't really remember what we discussed, but in one of our previous sessions, we said the woman, like I had a patient who had high fever early hours of that morning, and then she had abnormal discharge.
I think that's when we're talking about miscarriage.
I think something like that, and then refused to come to the hospital. She ignored it, and before 4 p.m. that day, she lost the pregnancy.
Fetus,
yes, so it could cause growth retardation in the baby, and then in the mother, it could cause a miscarriage. It can cause her to lose that child.
Okay.
Yes.
So let's talk about PEP and PrEP. You know, some people tend to abuse it. They'll tell you because of the fact that it's available. Like if you know you want to, because you are not sure of the person you will sleep with, you should take it. Let it be in your system. Why some they'll be like anytime they just sleep with anybody, they must take it. Just so is that not like a form of abuse?
Obviously.
Or is it advisable that you should do that?
No.
Okay.
It's highly not advisable, and equally is a form of abuse. The reason is this: just like the name, post-exposure, it would only work after an exposure.
Okay.
Yes, it's different from a vaccine. A vaccine is what gives you that
Immunity.
protection, immunity against this virus.
Yes.
But for the post-exposure, it's after you've been exposed. Secondly, for someone who keeps abusing it, it may get to a point where this person gets resistant to it, such that when it is needed, it won't be able to do anything for the patient. Okay.
Partners who hide the fact that they've been infected.
Okay.
Let me put it this way. How can partners learn to talk to their partners, especially when they are infected? You know, some people, we have learned that staph is not only transmitted through sexual infection, right?
Yes.
So sexual intercourse.
Yes.
Then maybe the partner now gets staph. And then they're like, you cheated. You know, that kind of thing. So
yes.
how can partners be free to talk about these things to their partners?
Okay, I feel, first of all, like, you calling yourselves partners, you should be that free with yourselves. And very important, learn to say the truth to each other.
Okay.
Because you saying the truth to her, you're equally saving costs and protecting her. And it's not like it's a death sentence. Do you understand? If people discuss it, there are good ways to handle it. And it can be treated. Exactly. So I don't think there's a reason or a need to hide it. Especially when you're sure you didn't cheat.
Yes.
Yes, it was maybe from another route. Just like I said, one of our sessions where we discussed post-streptococcal glomerulonephritis in kidney injury. Yes. I told you, staph is one of the causes in adults. Yes. So, especially when you know you didn't cheat. But even in a case where the person cheated, you can still come clean and talk. Honest, tell her or him about it.
Okay.
Provided God has forgiven, and then you talk to the person about it, people can always resolve
work it out.
Yeah.
So the big question before we round off,
Okay.
if someone gets tested positive for a sexually transmitted infection, what's the next thing to do?
Okay, the next thing is to see your healthcare provider.
Okay.
Don't just go and get medications and self-medicate yourself. It's wrong, because you may be taking medications that will further propagate the growth or the multiplication of the organism. So it's very important you see your healthcare provider.
Okay, so Dr. Favor, what you're trying to say is that STIs are not only for people that are promiscuous.
No, not at all.
Say it again.
STIs are not just for people who are promiscuous.
Okay.
Anybody
Can be infected.
could be infected.
One way
or
or
the
another.
other.
So please make sure, and on that note, we want to call it a wrap on this episode. Make sure to always check your status. I think how many months interval should people check should go for all the screening tests?
Okay, I think 3 monthly.
3 months.
Yes, that's
especially if you're
important
sexually
to me, yeah.
active. Yes.
But if you're sexually anyway, 3 months. 3 months is okay.
Okay, so especially if you're sexually active, if you're not sexually active, to go, because sometimes you may be like exposed to it through the barber salon, or where you're making your hair, or you just a needle prick, like we always say.
In healthcare workers.
In a healthcare worker, and
even
everything.
if you're not a healthcare worker.
Yes, something could have happened. So please make sure to go for your screening test. And if you have a partner and you've been infected, what's the worst that can happen? Just talk first, and we can resolve it from there.
Exactly.
It becomes
because
worse.
that way you're saving the partner, saving finances, and then saving future consequences.
Because it becomes worse when the person is not, you are trying to hide it from the person. And maybe some of them, because of the fact that these STIs do not show symptoms, they go untreated, because this person, not knowing that they've been exposed to that particular
they'll just
infection.
have it in their mind that this is my usual partner, nothing new, and they will not even bother getting treated. But if she's in the know, she'll ensure that you get treated first before you continue your daily life.
Yes. So it will even help that curb whatever it is, and the person can catch that infection on time and get rid of it before it progresses to something else and the whole matter gets blown. Thank you so much for hanging around with us on Health Unplugged, brought to you by Lifeway Medical Diagnostic Hub. My name is Amazing Reader.
And my name is Dr. Dimba Favor.
Until we come your way another time, do well to check on our previous episode. We have an amazing topic that you would enjoy. And do not forget that if you have any question, drop it in the comment section and Dr. Dimba will be there to answer your questions. We love you. Thank you for watching. Bye.
Bye-bye.